Someone works at the same company for 5 years straight. Same job, same health, no major medical events, no new conditions. Every single year during open enrollment, the same basic health plan costs noticeably more than it did the year before, sometimes by a meaningful percentage, even when the plan's actual coverage barely changes at all. HR sends the same explanation every time, something vague about rising healthcare costs, and most employees simply accept the new number and move on. Understanding what's actually driving that annual increase and why it happens with such remarkable consistency across almost every employer in the country reveals a system with several distinct, identifiable causes stacked on top of each other, most of which have nothing to do with any individual employee's personal health. It's the kind of increase that feels personal in the moment, showing up right next to that specific employee's own name on a benefits enrollment screen, even though almost none of the actual math behind it has anything to do with that particular person at all. Employer health insurance costs get discussed publicly, when they get discussed at all, in extremely vague terms: rising costs, inflation, the healthcare system being expensive. And that framing isn't wrong exactly, but it obscures a set of specific, measurable mechanisms that combine every single year to produce that renewal increase. According to research published by health policy organizations like the Kaiser Family Foundation, which tracks employer health benefits annually through detailed national surveys, average employer-sponsored health insurance premiums have risen faster than general inflation and wage growth in the majority of years tracked over the past 2 decades, a pattern driven by several compounding factors that operate simultaneously rather than any single, isolated cause. This gap between premium growth and wage growth matters well beyond a single renewal notice, because it compounds year over year, meaning the share of a household's total compensation effectively consumed by health coverage tends to grow steadily over a career, even when nothing about that specific household's actual medical needs has changed at all. Let's start with the basic mechanics of medical cost inflation specifically, because healthcare pricing behaves differently from most other goods and services in the broader economy. Prices for medical services, prescription drugs, and hospital care have historically risen faster than general consumer inflation for a combination of reasons specific to that industry, including the increasing cost and complexity of new medical technology and treatments, hospital and provider consolidation, reducing competitive pricing pressure in many regional markets, and the administrative complexity of the billing and insurance system itself, which adds substantial overhead costs that ultimately gets built into the prices insurers negotiate and pass along. The technical process works like this. An insurer calculates a group's expected claims cost for the coming year based on that specific employer's claims history, combined with broader trend data about rising medical costs across their entire book of business, then prices the renewal premium to cover that projected cost plus administrative expenses and profit margin, meaning even a company whose own employees filed unusually few claims still absorbs a meaningful portion of the broader medical inflation trend affecting the insurer's entire client base. This is where an invisible mechanism specific to group health insurance takes over, one that operates somewhat differently from how individual insurance risk gets assessed. Employer group health plans price renewals partly based on the specific group's own claims experience from the prior year, meaning a single employee's expensive medical event, a surgery, a cancer treatment, a premature birth, can meaningfully influence the entire group's renewal premium the following year, even though every other employee in that group did nothing differently with their own health during that same period. Because employer groups, especially smaller ones, represent a relatively small risk pool compared to the broader individual insurance market, a handful of high-cost claims can move the average cost per employee substantially more than the same number of claims would move pricing in a much larger population, which is precisely why smaller employers frequently see more volatile year-to-year premium swings than larger companies with thousands of employees spreading the same statistical risk across a much bigger pool. There's a related invisible mechanism tied to how healthcare providers and insurers negotiate pricing more broadly, one that shows up as a persistent upward pressure independent of any specific employer's claims history at all. Hospital systems and large physician groups negotiate reimbursement rates with insurers, and in many regional markets, provider consolidation, meaning fewer, larger hospital systems controlling a greater share of available care, has measurably reduced insurers' negotiating leverage over time, allowing providers to secure higher reimbursement rates in contract renewals than they could in a more fragmented, competitive provider market. These higher negotiated rates get built directly into the baseline cost insurers use to price every employer group's renewal, regardless of that specific group's own claims experience, meaning even an unusually healthy group of employees still absorbs rate increases driven by underlying contract negotiations happening well outside their own employer's control or visibility. 2 real-world patterns make this concrete. Kaiser Family Foundation's annual employer health benefits survey has consistently documented average family premium increases outpacing both general inflation and average wage growth across the vast majority of years measured over roughly the past 2 decades, a gap that compounds meaningfully when tracked over a full multi-year period rather than any single annual snapshot. A second pattern shows up specifically in how employers respond to these rising costs, where survey data has shown a consistent, long-term trend of employers shifting a growing share of total premium cost onto employees through higher paycheck contributions, higher deductibles, and higher out-of-pocket maximums, a strategy that doesn't reduce the underlying medical cost trend at all, but instead redistributes who absorbs it from the employer's budget toward the individual employee's paycheck. And out-of-pocket spending. This challenges the common assumption that a rising health insurance premium primarily reflects something changing about a specific employee population's health or behavior. Sicker employees, more claims, worse habits. In reality, a meaningful share of any specific year's increase reflects broader medical cost inflation, provider-insurer contract dynamics, and small group risk pool volatility, factors that exist largely independent of any individual employee's personal health choices. The friction point isn't that healthcare costs aren't genuinely rising. They demonstrably are. It's that the vague framing typically offered to employees, healthcare costs are going up, compresses several distinct, separately identifiable mechanisms into a single unexplained number, obscuring how much of that increase reflects industry-wide dynamics entirely outside any individual workplace's control. Zoom out, and this same multiple compounding cost drivers presented as one vague explanation, pattern shows up in other recurring expenses people encounter regularly. Property insurance premiums rise for a combination of reasons, including regional catastrophe risk trends, reinsurance market conditions, and construction cost inflation, all frequently summarized to consumers simply as rates are going up. Cable and internet service pricing similarly combines content licensing cost increases, infrastructure investment, and standard annual price adjustments into a single renewal number that rarely gets broken down into its actual component causes for the customer receiving the bill. In every one of these cases, a genuinely multi-factor cost structure gets compressed into a single, vague explanation at the point of communication, which makes an increase driven by several identifiable, sometimes explainable factors feel instead like an arbitrary, unexplained cost of simply existing in the modern economy. The pattern repeats often enough across different industries that it's worth treating as a general rule rather than a coincidence. Whenever a recurring bill increases and the explanation offered fits in a single sentence, there's a reasonable chance the actual cause is several separate, more specific forces bundled together for the sake of a simpler conversation. So the next time a health insurance premium rises again despite an employee's own health and habits staying essentially unchanged, it's worth remembering what that number actually represents. It probably isn't a reflection of that specific person's own medical history or behavior. It's more likely a combination of broader medical cost inflation, provider-insurer contract dynamics playing out well beyond any single employer's visibility, and the statistical volatility of a relatively small group risk pool, all bundled together into a single renewal number that arrives every year with far less explanation than the actual underlying causes would probably deserve.